Yeah, Tom, thank you very much for the opportunity to speak. As an anecdote, I've been on service for the last 2 weeks, and I think I've fixed probably half the ribs in the Salt Lake Valley, enough to make a nice barbecue here with everything that's
Save
been.
some for us.
Yeah, so definitely timely topic. If I can editorialize for a second, I just want to reach out to the students and trainees that may be watching. This has been a great overview of how to do good science, and in this day and age where expertise in science is being uh, called under question, it's imperative on those of us that are doing this to do it well and do it right, so that we let the data speak for itself. So hopefully you're getting a good introduction if you haven't seen this stuff before, and for those of us that are what was it, grizzled veterans, are getting a good review of best practices. So I was asked to go over quickly how to write a paper. I've written a couple. Some folks seem to like them, so I'm happy to share what I know. Um, there we go. So I have no disclosures. I would like to say that most of the information from this presentation is from Dr. Justin Dimmick's paper. You can see the link there. Dr. Dimmick is an amazing scientist, chair of Michigan, a surgical oncologist, I believe. And my partner, Dr. Martin McCrum, actually gave a version of this talk to our residents during resident education. So really the lion's share of the credit should go to them for this talk. So why do we care about writing is what we're going to talk about. And then briefly, I'm going to go about talking about abstracts and manuscripts. I think we've read enough papers that we all know that scientific writing is broken down into the introductions, methods, results, and discussion. But why do we care? Why is this important? So why do we care? So, it doesn't really matter how awesome your results are, how groundbreaking or innovative. If your paper is boring, poorly written, hard to understand, it's going to be very difficult for you to disseminate your information to your colleagues and get best practices out there. So while doing the science and getting the IRB done correctly and good statistical planning is all important, being able to convey your ideas and findings in an efficient and interesting manner is imperative to the dissemination of scientific discovery. And all these skills for people that are working on writing and feel like they struggle with it, and it's important for everything that we do. Grants, public speaking in forums like this, promotion if you're in an academic environment, leadership positions. It's all important. All these communication skills will serve you well throughout your career. And, the best papers are concise, they flow, they're well written, they show a clarity of thinking, so that even complicated scientific ideas or scientific findings or complicated statistical analyses are well described and understandable to the wider audience that's reading them. And of course, the best way to learn about how to write a paper is to do a study and write a paper about it. So hopefully those of you watching will jump on some multi-institutional trials that the CWIS is putting together and answer some of the questions that have been brought up today. So the order of writing is pretty standard, but what Dr. McCrum advocates doing and what Dr. Dimmick liked to do is to write the abstract first. We tend to do that because we tend to, be working on short deadlines, get our data back, write an abstract in time to submit to a meeting, and then we worry about getting the paper finished if we have a deadline because our abstract got submitted and accepted. So we work on the abstract first. Last paragraph of the introduction is important because that really is where you're supposed to put your hypothesis and the scientific question that you're trying to answer. So part of good training or good writing and good planning for your study is to really be able to communicate your idea succinctly and then to have your scientific question well framed. So writing the abstract and the last paragraph of the introduction really should be done in the planning part of your study. Then usually we get our methods back so we can write up how we did the study, the statistical analysis we chose, the inclusion-exclusion criteria, the randomized controlled trial, what have you. But that should be written as part of your IRB. A lot of this work should already be done. Once you get the results, you write the results out. Try not to editorialize. Just report what you got. The discussion is where you get to wow the scientific community and the surgical community with your innovation and how you interpret the data. That's really the opportunity to be most creative. But it's also one of the hardest parts to write because you have to put a lot of your own creative thought into it. Then, finish up the introduction, frame your question, give the background, the hook to get your readership involved and interested in what you're writing. And then I'll repeat this throughout this talk and through our panel is to revise, revise, revise. Your first draft should just be that. It's just a draft. The best papers are critically reviewed by yourself, your mentors, the co-authors, hopefully a good group of people that you work well with that can, really brush the paper up and make it the best that it can be. So the abstract should be the summary of the research article. Same format, intro, methods, result, and conclusion, but you got to be succinct. Usually you have a word limit, especially if you're submitting it to a society meeting so that you get a poster or a podium presentation. You only have the space to focus on one or two of your key findings of the paper. It's okay to leave out the secondary and the interesting stuff, but really you want to focus on your main findings, the findings that you think are actually key to answering your scientific question and what are the most interesting things. The abstract and the tables should tell the story of your paper. The reviewers and people that are reading through the abstracts, you want them to be interested and to think that this is a valid question and for the results to make sense. And this is what editors and program committees use to make their first cut. So if your abstract is unclear, your tables aren't good, you're not communicating well and succinctly, your paper's not going to get picked up. So as I said, it doesn't matter how cool your findings are. If you're not able to communicate them well, they're not going to get disseminated. And then always, again, be careful about overreaching in your conclusions, especially in the abstract. Wild claims need wild evidence to back them up. So, you got to make sure that you and your authors make conclusions that are very much supported by your data. And again, hopefully you've planned this out. You have a good research question. You've designed an appropriate study to answer that research question, and your conclusions are supported by the data that you found. Abstract is very important. Introduction, paragraph, they talk about a 3-paragraph format. Obviously, there's some wiggle room, but these are the things that you want to communicate within your introduction. First is to state the problem. What are you trying to answer? In our last session, we're talking about long-term outcomes after rib fixation. That's a problem. We don't know what the outcomes are. We want to be sure that the interventions that we're offering to our patients actually make a difference in the long term. So not too broad, not too narrow. It takes you want to state this succinctly, and then something that logically will follow that you can answer with the paper that you're about to write. Then you need to show the knowledge gap. So you need to state the problem and then show what is known and what we don't know. And the gap needs to be exactly what your study is going to answer. So this is your opportunity to be a little bit creative. You have to become a sort of mini expert in the topic. Read, it takes me 20 or so papers to write this one paragraph, the background paragraph in the introduction, because you really need to have a grasp of the literature. Hopefully you've done that as part of your study design, and the study, what you're trying to answer. But this is your chance to spin. We don't know this. This is what we want to answer. My paper is going to do that. Our paper is going to do that. And then the last paragraph is your aim and your hypothesis. So your outcomes, the scientific question that you're asking and going to answer should line up with the knowledge gap that you just created. So it takes some practice and takes a lot of revision to make these 3 paragraphs flow well. But critically important that your paragraph makes sense, teaches your audience, and is easy enough to read. So state the problem, create a knowledge gap, and your aim and hypothesis. Methods. So this depends on the kind of, how detailed and how long this section is. Depends on, what you're writing, the kind of study that you're doing. Format varies depending on the journal that you're submitting to. You can use subheadings, your data source, patient population, what outcomes, your primary and secondary outcomes, your statistical analysis, inclusion, exclusion criteria. If you're doing a fancy a propensity scored matched analysis, or you do some cost effectiveness and computer modeling work like I've published on, you need to be able to describe what a Markov model is and how your simulation was put together. So this will vary, but most of the methods section should have been planned beforehand, because this is what you have to submit to your IRB. If you're doing something complicated with statistics, unless you have some kind of advanced degree in math or statistics, a statistician is helpful and should review your methods and your statistical analyses to make sure that you're using the right test for the question that you're asking and for the distribution of the data that you have. Obviously, you can give a long talk about the misery of statistics, but get help for your methods section. You should get that help before you're sitting down to write the paper. Results. Again, multiple paragraph subheadings if necessary. This all depends on the kind of question that you're asking and answering. Stick to the order of your methods section. You want to use the same organization throughout your paper so it flows well, it's easy to understand, and people don't get confused. And then, just double check to make sure the numbering of your tables and figures are correct. Summarize the most important facts, and don't editorialize. I can't emphasize that enough. You really just want to describe what you found. Let your numbers stand for themselves. Your discussion is where you describe what the numbers mean. So here, just stick to the facts. Make sure, again, in your results section that if you're using abbreviations or using terminology for either rib pain scores or outcome scores or SF36, you use consistent naming of your variables and consistent abbreviations, because if you start, this isn't creative writing. You don't want to use variety and synonyms to make it interesting. You need to keep everything as similar and use standard naming for things, so your readership, your audience doesn't get confused. So stick to a consistent order of presentation, stick to the order that you wrote in the method section, and make sure that things are numbered and abbreviated and named consistently. For the discussion, I think the discussion is always the hardest part to write. Luckily, I have a good group of partners and folks that I collaborate with, and we either sit together, or I guess we used to sit together in meetings or Zoom meetings, and we kind of discuss the findings. I find this more easy to spitball and to discuss in a group. Your mileage may vary. You may want to do the discussion on your own and present it to your co-authors. But really, this is the part that you really need to put a lot of thought into is, what do your results mean? Now, obviously, you have an idea of what you want to say in your discussion because you've done a good job planning your study. You've asked a reasonable research question. You've shown that there's a knowledge gap, and your IRB has approved the study. So your discussion shouldn't be coming out of left field, but it can be tricky to convey innovative findings or interesting findings well. So the first paragraph really just, again, summarize in as plain language as you can the numbers and things that you found in your results section. Highlight the one or two key findings of the study. Ideally, it's the same one or two findings that you highlighted in your abstract. Again, you want to repeat, reinforce, and keep that consistency with your writing. And then the last couple of paragraphs, you want to put your findings into context. So this, again, all that reading you did to be able to create a knowledge gap and provide a good background and frame your research question, you're going to put that to use here in your discussion. Talk about where the literature is, how your findings add to the literature, what's innovative about your findings, and then finish up with this is how it's going to change practice, or these are what we need. These are the things that we need to accomplish to move forward. End each paragraph with a sentence on how your study extends or builds on those of others. None of us operates or does research in a vacuum. You can just PubMed just about anything and see how much literature there's out there. Science really is an iterative process, as we all know, and tying your research into what other people have found reinforces positive results, or if you think people are doing things incorrectly and your study shows that we should be doing things differently, you really need to base that conclusion on the literature that's out there already. And then think about those who might review your paper. If you're referencing experts in the area, there's a very good chance they may be on the editorial boards of and hopefully you reviewer number 2 you've maybe referenced, putting a plug in for our next chat, so they won't shoot you down completely. But it's always to keep interesting to keep that bigger picture in mind. I think CWIS has a very good representation of people that have been doing a lot of work in fixing ribs and chest wall injuries. So if you're doing a rib plating paper, you're going to be reading Dr. Mayberry's work and some of the other folks that have just recently been on. So be familiar with that literature and be able to incorporate what you found into what's been found before you. Paragraph 4, or the limitations section. This is key. This is where you try to mitigate where you think you have chance bias or confounding. Kind of highlight the areas of your research design that mitigate these issues. Again, if you're doing a propensity scored matched analysis, you're trying to mitigate bias in your retrospective data by using a PSA. So I think the limitations section is, again, it's kind of hard to write because you don't like criticizing your own work. But if you don't do a good job at this, then there's a good chance people will be like, well, they didn't consider this bias, or there's a confounder here they didn't address, or their exclusion criteria were inappropriate. So you really got to think about how are people reading your paper going to criticize it? How if you're standing up at AAST, how are folks going to, what questions are they going to ask when they come to the microphone? So you want to try to think about those. Hopefully, again, you've done a lot of this work beforehand when you're planning your paper and planning your writing, but key to address potential criticisms of your paper in this section. And then paragraph 5 is kind of where we need to go forward. Please don't be lazy and just say we need more randomized control trials, even though we probably do need more randomized control trials. But try to be innovative. Think about how your findings affect patients. The 4 Ps, as Dr. Dimmick described it: patients, providers, payers, and policymakers. So put a little bit more thought of how your findings affect the stakeholders in the healthcare system: patients, doctors, people that pay for it, and people that make the laws. And these are just some graphic summaries of what I just talked about from Dr. Dimmick's paper. The abstract helps you keep focused. It's your foot in the door to get your paper presented at a meeting or getting published. And after publication, it's probably the only part that a lot of folks are going to read. So you want to make sure that your abstract communicates effectively. Need to do a good introduction, give context, create a knowledge gap, and preview your plan of your scientific question. And then your discussion, summarize your findings, put them into context, discuss your limitations, and and really implications moving forward. What does your paper do? What do your findings do to move forward the practice or the topic that you're talking about? And as I said, revise some more, and seek a lot of feedback. Get all of your co-authors involved and make sure it's a group effort. And with that, thank you very much.